All right, this will be a video on Foley catheter insertion. I will do it on a male. We will do an in and out cath. So what you need to do is gather supplies, and this is going to be just a catheter that goes in and out to drain the bladder. We will not be doing an indwelling catheter in this video. All right, so we've got those supplies. Now, what we want to do before we start any procedures, we actually want to go and check our orders in the chart to make sure that we are following the orders of the physician or the healthcare provider. Once we have orders, we will now go to our patient and begin to explain the procedure. We want to identify our patient with two patient identifiers, their name, date of birth, or their name and account number, or whatever your hospital policy is. So we want to do that, and then once we've done that, we want to explain the procedure to the patient and make sure they understand exactly what we're going to do. So once they're agreeable, then we can start our procedure. So this is Mr. John today. He has agreed for me to be able to go ahead and drain his bladder. The doctor wants to know how much is in his bladder because he's having trouble urinating. So we will go in and do an in and out cath on Mr. John. All right, so now I'm going to start my procedure. I am going to wash my hands and clean them, do care, and then I will also bring along myself just some regular gloves to start with. I also bring another extra set of sterile gloves because there's one in my kit, but I bring an extra set just in case to the bedside. And so once I've got my non-sterile gloves on, I'm just going to get also some towels or some wipes to be able to do perineal care on Mr. John before starting our procedure. Once we've got that done, then we can start inserting our Foley catheter. So what I'm going to do now is go ahead and adjust my bed. I'm going to let my bed up, and then I'm going to just do it at working height, so you'll be able to kind of see what I'm doing here. And then I'm going to uncover only what I need to uncover for Mr. John, protecting his privacy and his dignity. So here we'll just let our covers down. We'll go about here, and then we will go up with our gown to about here, and so that we can see. All right, perfect. All right, thank you so much. So now here we go. We'll do this. We've got our Foley catheter kit. We did our perineal care. I do want to caution you that on our males, if they have not been circumcised, that if we pull the foreskin back, that when we are done, we remember to pull the foreskin back down. Okay, you never want to leave the foreskin up because it can cause constriction to other blood vessels there, supplying blood to the penis. All right, so this is our kit. We will open it up. All right. We always want to go away from us for that very first opening because remember we have to keep everything sterile, and this is going to be our little sterile table. And then we will open this way. We never want to go over our sterile. We will go this way. And then the last one that's folded this way, we will come back to us. So now we've got our little sterile field. We can touch the outside corners of that, but we never want to reach over our patient. Now, there is a little drape in the top of this one that we can use to actually create another barrier or elongate our sterile field around our patient as we're putting in our Foley catheter. So here, shiny side will go down. All right. And we will I usually just kind of drop it here, okay? Now, my sterile gloves are next. So I'm going to take my sterile gloves, try not to contaminate myself, and I'm going to put on my sterile gloves without going over my field. So what I've got here is I've got my sterile glove. I'm going to pick up one, and I'm going to just step back and put on my sterile gloves to make sure that this procedure stays sterile. Get my second one, and I can touch it just because, just make sure your hand doesn't touch anything. So this is my sterile gloves. I'm putting them on all the way in, and then now I've got sterile field. Now I do use my fenestrated drape, which is the next one that's going to come up. I use that one especially on my males. All right. Kind of clean to create myself a little barrier or opening there. I know it's a little hard for you to be able to see, but I promise I'll pull it up. Now, the one thing you want to know before you start this kit, because most of them come with providine, iodine in here. I'm not going to open this one because I don't want this solution on the patient, but I would caution you to make sure that your patient is not allergic to iodine, okay? So before opening this up, find out for sure if they have any allergies to iodine or anything like that, because you wouldn't want to use iodine on them. All right, so I'm going to say that they're not, and I open up my little solution and I saturated my little cotton balls here. So I've got all my cotton balls saturated with iodine. Again, I will not open this because I don't want to stain our mannequin here. Then I've got my little kit here. This is going to help us. We use this to pick up all our little cotton balls. I'll put that here. In this little kit right here on the side, we've got some lubricating jelly or tube. We will open that up and we will squirt it right here in our little tube. So I'm squirting my little lubricant right here to be able to lubricate the end of my Foley catheter. All right, so now underneath here, inside of this little thing has all of our other little supplies inside of our little kit here, as you can see. We've got a bottle for a urine specimens, because we would always want to do a urine specimen on this patient, and maybe urine culture if we're putting in something like that. With our little cap, everything in here is still sterile, okay? So I'm just kind of moving everything over. You've got sterile water that we would use to put in if we were going to leave our this Foley catheter in place. Again, I'm not going to leave this Foley catheter in place. I'm just going to drain the bladder here, okay? So, but let me just show you how we would do that in case we did. So we got our lubricant. Now, you will notice, because I'm draining the bladder, if you will look, there's a little hole right here, in here. So I'm going to use that to put my little Foley catheter, my little tubing to drain right through there once I've got everything into the patient. So with that, I'm going to put my little kit down here. All right, and then I'm going to open. It should be able to tear. We should be able to tear it to be able to get right into our Foley. Let's see where, if there's a thing on there. Maybe there isn't. Interesting. All right, well, we'll open it here. Usually there's a piece that tears off. So I'm going to take it, but make sure we're not letting it touch anything. So we don't want it to touch, we don't want our tubing to touch anything. If it does, we'd have to start over because we would no longer be sterile. So there it is, and then I'm going to lay it right into my lubricant, okay? My ability to drain right here, okay? Right into my lubricant. Now what I'm going to do with this one is I'm actually going to take this and transfer it over to our bed. All right, so just sit it right there, all right. Then we would explain, all right, Mr. John, this is going to be cold and wet. I'm getting ready to contaminate my non-dominant hand and take the penis so that we can see. So I've got it where you can see it. And then I would take my gauze that's saturated with iodine, unless they're allergic to iodine, and I'm going to start cleaning right at the meatus or the opening. And I'm going to just clean and clean and clean, and then down the shaft a little bit, and I'm going to dump that one. And then I will do it again. I will start right at the meatus, and we will clean and clean and clean, and down the shaft a little bit, and then dump it. And I would do that at least once more, okay? Unless we've just got a real reason that we need to clean more all the way around. If you can kind of see a little bit down around it, and then down the meatus, and then we're done. So we're done with that. Now we're ready to insert. Let them know there may be a little bit of pressure coming. So right here, as you can see, we're going to be able to go right inside of the penis. All right, so here we go. It's a little hard for you to see with my hand. I'm trying not to contaminate anything, and also. And so you would just go until you see urine starts to drain. So now the bladder is starting to drain. You can see it, and then just advance it about 2 inches more unless you meet resistance. Okay, so we're in, and then we would just let our bladder drain. And so we'll just let all the urine drain out of the bladder, and then once we've got it and we're not getting any more urine out and we're done, then we would let Mr. John know we're coming out, Mr. John, that we're done, and pull it all the way out. All right. And then I usually will, again, at that point in time, just kind of wrap it in my fenestrated drape and just kind of go from there. Okay. And that really is the extent of doing an in and out cath. Again, you want to take it. You want to measure how much it is. You want to take a look at how much you've got in your tubing. Adjust it up a little bit. And then we want to just kind of look to see the color of it. What does it look like? How much do you have? What is the clarity? Is it cloudy? Is it just, does it have sediment in it? Then talk about how Mr. John tolerated the procedure. Did he tolerate it well? Did he have trouble? Were there any issues with you placing the Foley catheter? So we want to do all of that in our charting as we take a look. And then again, of course, that we sent a sample to the lab. We'll send a sample and a culture to the lab if ordered. So make sure you follow your doctor's orders to figure out what it is that they're actually wanting to run the lab for the urine. And then after that, we go ahead and we start cleaning up all of our supplies. We can change our gloves now, wash our hands, put on clean gloves, and then help Mr. John get situated. So I'm gonna change these gloves out. And I'm just gonna put on myself some regular gloves. And then I'm going to just, after I put on some regular gloves here for Mr. John, I'm just gonna make sure that I go ahead and help him get cleaned up again, because remember, I use betadine and everything on him. So we'll get him cleaned up, washed up really, really good. And then we will cover him. We will go ahead and cover him back up and ask him how he's feeling. Is there any concerns that he might actually have? And then talk with him about that and just let him know that what labs we're doing, and we're gonna send those to the lab and the doctor will come and give him results. Okay, thank you so much.